Welcome back to the show. This morning we are joined by someone who's truly making a difference in our community, Cynthia Pevin, the Behavioral Health Director at East Jordan Family Health Center.
That's right, and Cynthia was recently honored with the Michigan Primary Care Association's Distinguished Service Award for outstanding leadership and transformative contributions to behavioral health services.
We're thrilled to have her with us today to talk about this incredible recognition, her work, and what it means to her in the community. Cynthia, congratulations. Thank you for being with us.
Thank you.
Tell us a little bit about what you do.
Well, currently I'm the Behavioral Health Director. I kind of wear a little bit of all hats, do counseling.
Sure.
We do integrated care, which is our behavioral health sit with our medical providers to provide services for anything related to chronic conditions such as diabetes, suicidal ideation. We're kind of like the on-call person for the team. So the primary care doctor can come in and say, hey, I need you, can you please help with this patient? And we kind of take that overall look at the patient, not just physical concerns.
Wow, that's a handful.
That's
It
a
is,
lot of work.
yeah. Yep.
Talk to us about the need in your community specifically, East Jordan or what other surrounding areas.
So currently we service Charlevoix and Antrim counties, and those are our population. So we take a community needs assessment. So a few years back, we look at like all of the data in those those service needs. So one was looking at 50% of teenage girls were having suicidal ideation.
Wow.
So that's a need that we've said, okay, we need to expand services, try to get connected with these populations. So we've done sports physicals for free for Charlevoix and Antrim County kids to help try to connect.
That's so wonderful.
Yeah, it really is.
It is. It's the support they need at a time when they need it. That I'm sure it goes a long way to them just feeling more comfortable about the whole situation. Yeah. So tell us a little bit, what is the Michigan Primary Care Association's Distinguished Service Award?
So the Distinguished Service Award is, you're nominated, and so everybody through the Michigan Primary Care Association, which is a nonprofit that helps us advocate for funding from the governments, state and federal. So there's about 40 members, like from different health centers in the state of Michigan, that all come in and they nominate you for this award. So whoever's making like a big difference.
That's great.
So it's all of your colleagues came together to give you this recognition. That is wonderful.
It is.
Did you know this was happening, or was this they called you one day and said you've received this?
No, I went to work, and it was one of those days where it's like, oh, I'm tired, and I showed up, and Philip Berquist, who is the president of MPCA, showed up, and I've never met him. He walked up there, and we're giving service awards for 5 years of service, 10 years of service, 20 years, and 25 years of service in the medical field at the health center. So we honor that there. And he said my name, and I was like, what? I was really shocked.
I'm not one of those years. Right.
Yeah, it took a minute, so yeah.
Oh, well, that's great. Wow. I'm curious, too, because we've had other doctors, clinicians on before, and they've talked a lot about the need, obviously, in the industry for especially behavioral health right now. Yeah. What do you see in that in terms of demand, but also that growth from interns to fully on-staff providers?
Yeah, there is a big need. One thing that we do is we have the ability to hire somebody who is from the community, who is working on their degree, to come in and work and also get their internship experience. A lot of fields are, like for social workers, as I'm a clinical social worker, we need to have like 500 hours of internship service.
Oh, whoa.
And that's a lot for the year. And then, people are trying to work and provide for themselves during that time. But we're able to hire staff and then train them and then hopefully keep them on to be a member of our team.
And as you grow your team, you can expand your services even further. What programs are looking to be expanded?
Yeah, we're currently looking to expand for veterans and connecting them to the right health.
Important.
Yeah,
so important.
And
right now.
it's a tough system to navigate. So we're trying to help that, and then we're also looking at our youth population and getting them the right screenings, the right services that they need, and just being a good support.
I'm curious with the youth, the young people especially. You mentioned the sports physicals as an example, but how do you bridge that connection? How do you not only talk to the the kids themselves, but even get that message into the schools, counselors, teachers, administration, of these services are not only important, but be actually available in town.
Yeah. So as being a community health center, we are involved with our community. So I coach cheerleading. I'm part of the Rotary. We collaborate with other programs like Kirsten's Ride, which is a suicide prevention program.
Are busy.
Yeah.
You are very busy.
So that's a really big part of what we do, is collaborating with the schools, trying to do what we can, and takes more than just one person.
And it's something about this that I find absolutely wonderful is clearly you're listening. You see the needs in the community through the veterans, through our youth. You see them in desperate need of this help, and you're just doing it. And that is so important, the action being taken to help these people. Where could someone potentially go to get more information on the programs available, the services available, and to maybe explore more about your career?
Absolutely. So you could visit our website, ejfhc.org. Also look up anything related to federally qualified health centers. You can find a lot through that. The National Association of Community Health Centers is a good place to look at that. And also, all of our information is on our website. Definitely it has our phone numbers to connect with behavioral health as well.
Perfect.
Excellent.
Perfect.
Cynthia, thanks for coming in. Congrats on the
thank you.
Distinguished Service Award. That's big.
Congratulations.
Thanks.
And not only big for you, but just big to show the availability in the community of just how much is going on. So we really appreciate you sharing your time with us.
Thank you.
Thanks.